Okay, well, thank you and welcome to our press conference today with the Ontario Medical Association section on pediatrics. With us at the table is Dr. Yamashiro and Dr. Peachy. They'll be making both be making some statements. We'll then open the floor to questions afterwards. So here we go. Hiro.
Thank you very much. Good afternoon, ladies and gentlemen. I'd like to, first of all, thank you all for coming this afternoon. My name is Dr. Hirotaka Yamashiro. I'm the chair of the section on pediatrics with the Ontario Medical Association, and we are here today to introduce the formation of the Pediatricians Alliance of Ontario. We would like to expand on the reasons for the formation of this alliance in the next few minutes. But before that, I would like to introduce Dr. David Peachy, who has joined me for this important news conference today.
Thank you very much, Hiro. My name is David Peachy. The company that we have been working with the section is Health Intelligence. It's a consulting company that deals with the public sector and the private sector. Major interests of the company have been in the use of administrative data and other data sets in terms of the development of health policy, various issues of funding of health care, and physician compensation models.
Thank you. Very pleased that Dr. Peachy is able to join us today. He'll be able to present some very important data that will support some of the concepts that we're bringing to you today, this afternoon. Pediatricians are very concerned that without immediate action, the health of children and infant and youth in this province will be in peril. We're here today because the children of Ontario are facing challenges the likes of which we've never seen in recent history. Whether we're talking about alarming trends in children's mental health, the rise in childhood diabetes, childhood obesity, and many, many other challenges, every time we pick up a paper or turn on the TV, we are seeing increasing examples of children and youth falling through the cracks, that there's been a suicide, a shooting, a school lockdown, or somebody's been a victim of bullying. We know that as a society, we have failed both our children and ourselves. Pediatricians are the premier experts and specialists on children's health care. Pediatricians are also the key cog in the delivery and allowing for timely access to appropriate care for infants, children, and youth to ensure the right care by the right people at the right time. Pediatric training in Ontario and pediatric care now delivered is second to none in the world. Yet, pediatricians in Ontario are finding that they need more resources to do the job that they're trained to do. They are currently working harder and increasingly finding it more difficult to get children the right care by the right person at the right time. Daily, we as pediatricians in Ontario are seeing increasing stresses from poor access to care. We have school violence, increasing child poverty, and other stressors in an overloaded system that are leading to increasing mental health issues, while medical issues of increasing complexity, such as premature infants, post-transplant patients, autism, and behavioral developmental problems, along with the alarming rise in childhood obesity, mean pediatric wait lists for a long list of problems are getting longer, and at present, pediatricians are waiting for more resources to deal with this growing list of issues. Whether we're talking about a 9-hour wait in the emergency department or children's hospital, the lack of access to basic dental care for children, or the challenges and barriers that immigrant children face of 90 days before being able to access basic health care, the list of growing problems that are affecting our children and youth are multiplying on a daily basis. The question that the pediatricians of Ontario are asking is, who's caring for the kids? Is there a coordinated effort to bring all stakeholders on side to begin to deal with this growing number of problems? To help with this, we asked Dr. David Peachy to gather data on the ability of pediatricians in Ontario to do the job that they're trained to do. And I'd like to turn it over to Dr. Peachy to expand on his report.
Thank you. In brief, just to summarize the general impression that the data brought to this issue, We looked at demographics and we looked at compensation issues. There's no doubt that there are serious implications both to the Ontario pediatricians, community pediatricians in the province, and to the patients they serve. There are far-reaching implications to it, and I think that's brought forward particularly in the 7 main conclusions of the report, and I'll just reference them briefly because they tell a story, and it's not a story that should make people feel very comfortable. We looked at a variety of things. We looked at the growth rate between the years 2006 and 2008, at the number of active pediatricians in Ontario. They grew at about 2.8%, which is just under the Canadian average of 2.88%, far under the Alberta growth rate of 10.2%. So there's a marginal growth rate inference by that. The greatest rate of growth, though, in terms of the age cohorts of Ontario pediatricians, was between the ages of 55 and 64 and over 65. It is an aging profession, but it is certainly an aging specialty. The numbers of pediatricians under age 40 had an absolute decline in Ontario, and the future is starting to become quite concerning about that group. Between the years 2004 and 2006, the data have brought strong evidence forward that access to pediatricians has been declining, particularly in Ontario when you compare to the data in the rest of the country. Overall, looking across the country for all pediatricians, it's become very clear that pediatricians are working harder. They work an average of about 2 hours per week more now than they used to within the past 2 years, and that's on direct patient care, indirect patient care, and related professional activities. At the same time, between 2004 and 2007, even though they were seeing slightly more patients in their offices, pediatricians in Canada were working about 25% harder and more longer hours in their on-call work than were done before, except the number of patients that were seen during that on-call time did not rise. And I think that speaks to the fact that the acuity level of the illnesses that the pediatricians are treating when they're on call continues to rise significantly. We looked at a lot of compensation issues, particularly with respect to the fee-for-service payments to Canadian pediatricians, and then focusing more in Ontario. The growth in the fee-for-service payments was certainly lower between 2004 and 2006 than the comparable data for 9 other common specialties. The rate of increase, though, was particularly low in Ontario and 2 other provinces, Manitoba and British Columbia. So we had a closer look at the fee schedule in Ontario, and the conclusions out of that were pretty straightforward. We looked at Ontario, British Columbia, and Alberta and Nova Scotia, compared various schedule studies, and Ontario pediatricians, by virtue of the schedule studies, are disadvantaged, and they're disadvantaged significantly to the degree that it's not a question of working harder or working more. The schedule does not serve them well. The numbers tell the story. The pediatricians are working harder. Their access is diminishing, and their funding is in a state of great difficulty for them. And I think that, as Dr. Yamashiro said, at the end of the day, they're not being served well, and their patients certainly are not.